I'd like to call to order this meeting of the Sacramento First Five Commission for Monday, August 6, 2018. Madam Clerk, will you please call the roll and establish a quorum?
Dave Gordon.
Here.
Beth Hassett.
Here.
Terrence Jones.
Here.
Olivia Kassiri. Bruce Wagstaff. Scott Moak. Donna Sneringer. Steve Wirtz.
Here.
Lee Turner Johnson.
Here.
Kathy Kossick.
Here.
Terry Porter.
Here.
Christina Elliott.
Here.
Patrick Kennedy.
Here.
Phil Cerna.
Here.
We have a quorum, and with the commissioners being out today, Terry Porter will be voting for Bruce Wagstaff, Christina Elliott will be voting for Scott Moak, and Kathy Kossick will be voting for Olivia Kassiri.
Thank you.
This meeting of the First Five Sacramento Commission is cablecast live on Metro Cable 14, the local government affairs channel on the Comcast, Consolidated Communications, and AT&T U-verse cable systems. This meeting is closed captioned and webcast at www.sacmetrocable.tv. Today's meeting will be repeated Wednesday, August 8th at 1 p.m. and Friday, August 10th at 1 p.m. on Channel 14. Members of the audience wishing to address the Commission may sign a speaker slip at the kiosk located in the back of the room. Please include the agenda item number that you wish to address and then bring the completed form to me. Please speak into the microphone when addressing the Commission and state your name for the record. If you have any electronic devices, please put them on silent or turn off now. Thank you.
Thank you. Ms. Galelo, will you do us the honor of leading us in the pledge today?
Absolutely. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, I want to welcome everyone to this afternoon's First Five Commission meeting. And again, just as a friendly reminder to those that have joined us here in chambers, you're certainly welcome to address this commission on any item that's on our agenda or any item that's not on our agenda. We ask that you please respect the 3-minute speaking limit so that everyone has an opportunity to address the commission if they so choose. So with that, our first item, please.
Approval of the June 4th, 2018 draft action summary.
Okay, anyone on the commission wish to change anything or comments? If not, I entertain a motion.
Move approval. Second.
Moved by Commissioner Hassett, seconded by Commissioner Elliott. All in favor?
Aye.
Aye. Opposed? Abstained? Motion carries. Thank you. Okay.
Public comment on non-agenda items.
Okay, as I just mentioned, your members of the public are certainly welcome to address this commission on any item not on the agenda. I don't see anyone approaching the podium, and nor do I have any speaker slips, so we will move on to the next item.
Executive Director's Report.
Good afternoon, Commissioners. I wanted to actually open my report by inviting Michelle Calles to come to the podium and introduce herself to those of you who don't know her. Come on up. She was just recently appointed as the Director of the Department of Child, Family, and Adult Services. And thought it would be great to have you see a face to go with that name.
Hi, everybody. Thank you for inviting me here. For those of you who I haven't met or had the pleasure of working with, I have been with the county for 22 years. Prior to coming here, I actually worked with Commissioner Hassett over at Weave. At that point, she was running around trying to drum up money, and I was a...
Wait, that hasn't stopped.
Yeah, I know. Let's just say she's even more highly skilled than she was back then. I was using the money to deliver services, and it's great to kind of be back partnering with Weave in a different way now. So I've been with the county 22 years, primarily in the areas of child welfare and mental health, although I did spend a couple of years at the district attorney's office in their victim witness program. And I think, you know, so many lessons are learned along the way, and that I continue to learn. But probably the biggest awareness for me as I went to different areas of service is that we are serving the same vulnerable children, families, and adults within different systems, within different partnerships, just serving them differently. And that I also learned early on we can do none of this work alone, that it's through partnerships, collaborations, that we can better serve members in our community. So that is just a foundational belief of mine, and I think we've established a lot of great partnerships over the years. And now in this new role, look forward to continuing those, building new ones, and getting creative and innovative to better serve our community members. So real quick on the reorganization, Julie just wanted me to explain, the Department of Health and Human Services has been around forever, but for 2 years, 20 of the years, I worked for that department. So there was a recent reorganization, in part because Department of Health and Human Services was so big. If you recall, that had Child Protective Services, Senior and Adult Services, Public Health, Primary Care, and Behavioral Health Services. And so it was decided to divide out, and on the health side, so there's a new Department of Health Services, that's behavioral health, primary care, public health, and under primary care is correctional health. So the mental health services that are delivered in the jails, local jails, including our CCC. And the Department of Child, Family, and Adult Services is Child Protective Services, and then Senior and Adult Services, which includes Adult Protective Services, the Public Administrator, Public Guardian, Public Conservator's Office, and then the In-Home Supportive Services Program. It's really now from birth to end of life, and I'm busily trying to absorb those functions and that whole world while I had exposure and worked with the senior population in my work through Mental Health Services Act. It's just a different angle now. So I'm looking forward to it. I want to thank the Commission for all the partnerships we've had and continue to have along the way. I think the ones that jump out most for current is the Black Child Legacy investment and the partnership there, as well as investment in the Birth and Beyond Family Resource Centers. We'll continue working on that to sustain those vital services within our community. And then also I want to say thank you for taking over the cost of the medical clearance exam many years ago when DHHS couldn't do it. Through the support of our board, thank you, we were able to continue funding that so it didn't go away. So we're really happy for that. So thank you for having me.
So before you leave the podium there, Michelle, I just wanted to say a few words. First of all, I want to welcome you here to this commission. You're always welcome to be here, and certainly we also welcome what you've mentioned several times, which is a very valued partnership. And I just, on a personal note, just want to tell you, as I approach the end of my second term and look forward to the commencement of a third, it's been a delight to work with you over these last 8 years, and I've learned a lot from you. And you have a very, very difficult post in county government, one that I think is not lost on any member of the Board of Supervisors or any commissioner up here, providing some of the most intimate levels of service, types of service to our constituents that any local government does. So it is incredibly important work. You are an incredibly valued asset to all of us, and we really look forward to your leadership in kind of this newly branded, newly organized role. So,
thank you.
Thank you.
Thank you.
Okay, now I'll jump into my executive director's report, which should be in front of you. The report starts with an overview of the changes to the state budget that had a direct impact on children and families. We're pretty happy overall with this budget. It includes the first state level investment in home visiting through CalWORKs. It also increased funding so that it would ensure that no child lives in deep poverty, and then held true to the what they said, that what the governor had promised a couple of years back in creating additional child care slots. So 13,000 additional child care slots. So we thought this is a great step. There is still, some concern about the sustainability of this budget and moving forward, and especially around child care slots, which tend to get added and then removed. So we'll just continue to watch what happens next
I think
year.
Commissioner Jones has a question.
Was that 13,000 statewide?
Yes.
seems like a tiny bit statewide.
Yes.
I was thinking that was county would be pretty good.
No, that was statewide, right. There's even a picture in your executive director's report of the First Five California's newly repackaged kit for new parents. The kit used to be a box. It used to be like the size of a suitcase, for those of you who've been around a while and remember this. It is now a bag, and it contains some of the current basic components. The DVD that's very popular goes over ages and stages and important facts that parents should know around brain development, nutrition, and physical and emotional health. It also has a board book for the child, and then many resources, parent resources for statewide agencies and services like WIC and others. And then each county commission can customize their kit, and we have, at Sacramento, have customized our kit. We have specific parent resources that are all about the services that we fund and local services.
Can I ask a question about that?
Sure.
So we can see by the mock-up here of the bags that you have the exteriors in both English and Spanish. But in terms of customizing these kits for each individual First Five around the state, can we, or are we adding languages? Could we add, so many kits in Hmong, so many kits in
Yes.
Cantonese? I mean, it seems like it would be pretty endless here. We have such a diverse community that we serve that if we're not doing that, we might want to think about it.
Yeah. We have, our customized kits are in English, Spanish, Korean, and Cantonese locally. And then statewide, there's Vietnamese and several other languages that we can order them in if we have a need. And we usually always order in the Vietnamese ones specific to the Lunar New Year celebration. Perfect. And other things. So yes, we can definitely get them in additional languages. We also sometimes, we always customize with a variety of things, a finger toothbrush for the children, a DVD focusing on fatherhood and engaging dad in the pregnancy and new child. And so other items come and go, but yes. Also in your packet are a couple of new books. These are 2 new Potter the Otter books that were available to commissions, as well as a book from First Five California called The Three Brainy Birds, which follows their campaign on Talk, Read, and Sing. And we received these for free and are distributing them out through our funded partners.
I just wanted to comment. These were, I think they're great, and you can read them in English, and then you can kind of go back and practice your Spanish.
Just practice your Spanish, exactly.
And the trip to the dentist included a lot of valuable information at the back that really kind of reinforced what we're all talking about. So,
yep.
Very
Thought
nicely
you would
done.
like that
very nicely
one.
done.
Yep.
Commissioner
yes.
Sorry.
Just really quick too, I was going to say that my kids are this age, so they love the books and stole them instantly. So
Good.
I thought they were really good.
Good to hear. I have 3 pretty exciting updates to share around sustainability. First, in the past month, our Certified Sustainable initiative has really moved into high gear. We have our agencies meeting individually with our sustainability coaches in small group, and then they're now just beginning their cohort meetings. And so we have 3 different cohorts. One is the Birth and Beyond effective parenting cohort, an early learning cohort, and a health-related cohort. And the effective parenting one just met last week. They had great conversations about Birth and Beyond as a collaborative and what sustainability efforts need to happen as a collaborative effort, and then also the individual family resource centers and sustainability at that level too. So I thought it was a great kickoff for the cohorts. They'll meet again throughout the year. I have a Prop 56 backfill update. That's the $2 tobacco tax that began in April of 2017. And we always knew that Prop 56 had the possibility of decreasing Prop 10 revenue and potentially increasing Prop 10 revenue. Decreasing it because fewer people would be smoking, increasing it because we would finally be getting e-cigarette taxation. So what we saw was overall an 18% decrease in revenue in those first 3 months, so April, May, and June of 2017, first 3 months, and we actually did receive backfill at 18%. So we were internally sweating it because we really had no idea what that backfill level was going to be and if it was really going to make up for the 18%. It did, which is good. And the not so great news is that we didn't see an increase related to e-cigarettes, and we're not really sure why not, but we're tracking it, working with the association and our State Department of Finance to kind of figure out what's happening with that money, and is it just below expectations, or or did they build it into the backfill so we're not ever going to see any of it? It was a little bit unclear about why we didn't see an increase.
Isn't the basis for the tax is a little different, regular tobacco versus the electronic tobacco, I'll call it. I mean, in
Yeah.
terms of, there's not really a pack to charge, right?
Right. So they're actually charging a tax by the ounce of the juice that people are using.
Okay.
So I don't know off the top of my head how many cents per ounce of that juice, but it would be what they hoped was the equivalent to 50 cents on 20 cigarettes in a package.
Let's not call it juice. Juice is
Okay,
good
yeah.
for you.
Like, what do you call it?
Nicotine
I
is
don't
not
know.
good for you.
Liquid
Liquid nicotine.
Liquid poison. Okay.
Yes, there you go.
Thank you. And then finally, Michelle did allude to this, that the Board of Supervisors in their June board meeting directed the CEO's office to use general funds to bridge Birth and Beyond for the first 3 months of this fiscal year. And also they picked up the entire Hearts for Kids program for the year. We're just unbelievably pleased with that. And the MOU with the Department of Children, Family, and Adult Services is on your agenda for later. But those two things really went a long way towards sustaining our services and making sure that even though the first 5 funding was cut, not a single child will lose a service during this time. So very excited. So I have a little bit of a long executive director's report today, but there's so much happening. We, First Five, Sacramento, is spearheading a maternal mental health collaborative. I'm really excited about this, to address the issues of perinatal mood and anxiety disorder. Our goal is to increase the knowledge of moms, of healthcare providers, of decision makers, legislators around maternal mental health conditions, and to make sure that folks know about what resources are available to address those issues. We have membership right now, so we've only met twice, but we have membership from all 4 health systems, from our community clinics. We have private practitioners as well as those working for HMOs, and we have many county department folks are on board. So at last count, about 35 people came to the table for our second meeting. It was really wonderful. There's just a lot of enthusiasm. And I'm staffing this, but really just trying to not direct it. I'm just trying to let the group naturally determine what needs to be done. But I'm very interested in how First Five could play a role in doing more than just convening.
Commissioner Elliott?
I have a question about the appetite in this group to discuss paternal mental health when a baby's first born. I don't know if it's popular, but I know that in my own experience, there was certainly an impact on my husband when we had our first child, and the stressors and the depression can hit the dad too.
Yes.
So I don't know if this is the right a forum to have that discussion, but I'm just curious if it is.
It is, and it has already come up, and it is one of the things that's on the sort of agenda. And what the group is doing is taking the next 2 months to develop a strategic plan for how they want to invest their time and energy, and what is the sort of most important things for them to address.
Thank you,
And
sorry.
it's definitely on their list. I have a brief staffing update, and that is, I think all of you know that we had an unexpected death of our senior accountant back in June. And we ended up partnering with the County Department of Finance to help us out during that time. And we essentially just bought some hours of an accountant who really was able to help us with the year-end close and the audit, which is what we needed most of. It also sort of helped us to decide that maybe that was the direction we wanted to go in the future, which is to just buy some time from the Department of Finance rather than have our own CPA level full-time staffer on board. So what we are planning to do is to reallocate that higher end position to an accounting technician, a lower position, and then just buy some time from Department of Finance. So I think it'll better meet our needs, and it'll better meet our declining revenue as well. And so I think that that is the direction that we're going to move. Excited to announce that we have added LinkedIn to our social media platforms. Latina and Aaron have been working on this. This is really different than any of our other platforms, which are all reaching parents and providers. This is really new for us to reach influencers, policymakers, others, business community leaders, as part of our sustainability, policy advocacy and sustainability work. And then speaking of policy advocacy and sustainability, we have our 20th anniversary coming up, and this will be it'll have a kind of a similar purpose behind our town hall convening from a year and a half ago, when we brought together, specifically asked electeds to come together. And we used that as a way to sort of forward our messaging around all the wonderful things First Five has done and the reason why it's important that we continue this work, and we're reaching out to others to help us do this through partnership. So our 20th anniversary event will happen this fall, and we hope to create a highly visible event. It'll bring together our partners and stakeholders and influencers. There'll be a brief speaking program, a video, maybe some awards around business-friendly awards, family-friendly awards to businesses, rather. We have filming for the videos taking place Thursday with Commissioners Cerna and Elliott are going to help us with the video. I don't want to say that where we're having it yet, but I think you guys are all going to be really excited when I am able to say, because I don't want to jinx it, but the date and location coming to you very soon, like hopefully even the end of this week. Okay. Finally, we have 3 very short videos that we've worked with RSE and the Sac Healthy Baby campaign. They're 30-second videos, one for each of the trimesters of the pregnancy journey. And they're on our YouTube page and sachhealthybaby.com. So we're ready whenever you are. Maybe, there you go. And that concludes my executive
We
director's
don't
report.
progress to watermelon or anything?
Yeah, I was kind of waiting for watermelon, but
That's good, I like that. Dr. Jones?
I had a chance on that. I'm very impressed with that SAC Healthy Baby site. There's a lot of very good information. I think you have longer videos on the first, second, and third
We do,
trimester.
yes.
They're very professionally done, good graphics, and a lot of information in, I think, 2 minutes or something like that. And just excellent. And then you have tips for dads. And so there's a lot of good. They have great, I think, nutritional little wordless, I guess maybe about a minute or 30 seconds.
Yeah.
That would be nice. There you had, I think, bananas and peanut butter and some fruits.
Oh, yes.
But kind of switching it up would be just a wonderful,
Thank you.
avenue to keep that going and fresh. It's great. I love that.
Yeah, Aaron keeps assuring me that people can't pay attention for more than 15 seconds at a time, so they just keep
I'm with
getting
you.
shorter.
I think it's getting shorter and shorter.
Yeah.
Very, very short attention span, apparently.
All right, so that concludes your executive
Yes,
director's
sir.
report? Okay,
Yes.
very good. Any questions for Julie before we move on? Seeing none, thank you. Next item, please.
Advisory Committee update.
Mr. Silva.
Good afternoon, and I'd like to welcome you back from your break. Hopefully everybody's rested and ready to go, right? Robert Silva, I am the chair of the First Five Advisory Committee of Sacramento County, and I'm going to be discussing our June 8th meeting. We did have some introductions. Christina Clinton actually stepped in for Julie, did a very good job, and she's one of the newer staff, so we made her feel at home. And we also introduced Sylvia Rodriguez, which is from mental health. We were very excited about, and she's already started giving us updates, so we're happy about that. I'm going to start off a little bit. We did a little bit of public comment on non-agenda items. What we discussed, I'm sure we've all heard the Anthony Bourdain suicide. Well, we started discussing about celebrities and suicide and mental health, and the reason this was relevant is we were having a presentation on maternal mental health. So we thought it was important to talk a little bit. Somebody is a celebrity with lots of money that basically was showing all these signs but never reached out and ended his life. So we talked a little bit about that, and we also talked about the stigmas. And maybe as a celebrity, that stigma, if you have mental health issues, maybe that can hurt your celebrity status. Maybe culturally it can hurt you in some way. So it was a very good lead-in to our actual meeting. We did our director's report, of course Christina did, and she talked that we really emphasized three things. Certified Sustainable Kickoff Meeting on May 21st. We were talking about the enthusiasm that was there and 60 contractors. We thought that's a great turnout. That's a lot of buy-in. So we were very encouraged by that, and hopefully that will sustain that. Also, we talked about Help Me Grow. And we were excited because now they're running and accepting calls, screening children, and connecting families to needed services. So we'd love to see that off and running. We did have a discussion on the data collection and analysis to understand improved systems. We wanted to know, how's that going to be used? And specifically, is it going to be shared? Because that could be very valuable information, not just for First Five, but for community in general. So we discussed that. And then we had Erin come in, of course, Miss Knowledgeable. And she answered a lot of our questions because it spurred a lot of questions. So very excited about that. We have a congratulations in order to you, the commission, on your Safe Sleep Baby campaign. We were told on May 9th the commission was awarded the Grantland Johnson Government Innovation Award from the American Society for Public Administration Sacramento chapter. Congratulations. Very worthy. A lot of work was put in, and we appreciate that. And also Chair Supervisor Cerna actually accepted the award. Very fitting. So again, congratulations. It's always nice to see your work come to fruition, isn't it? So nice.
Our work.
Our work, that's right. Your work. Okay. We had a presentation on maternal mental health from Chantel Allen Jarrell from Sacramento County Health Educator, and we had a Jessica Walker, and she is a speaker with Stop Stigma. And she had experienced some mental health, and she experienced not only her experiences, but her experiences having to navigate that system, and how hard it was, and stigmas even within her culture over mental health. Her being a parent, were they going to take my children away because I'm admitting to depression? So we found that to be very, very enlightening. They talked a little bit about mental health, postpartum depression, and major points is we talked about Prop 63, and we got a lot of information on Prop 63, how much the funding was for, where exactly it's going. One that really shocked is 2/3 of people who have mental illness do not seek treatment, and everyday people live with mental illness, and mental illness is not what you think. And we talked about stigmas. And we talked about cultural stigmas. That's what really shocked us, is within cultures sometimes there can be very specific stigmas that you don't want to admit that you have mental issues of any way. We also have one more presentation about from Oral Health Update, Early Smiles, Every Smile Counts, Smile Keeper Strategic Oral Health Plan. Chris gave us an update, and she is the program coordinator from First 5 Oral Health. We had a PowerPoint presentation on Early Smiles program. They want to reach 21,000 people. That seems like a large number to us. We found it to be very ambitious, but hey, might as well be ambitious, right? So we were really pleased to hear that. The Sacramento County Oral Health Program is in the process of conducting a countywide oral health assessment. We were very interested in that. We want to hear about this. Countywide, does it differ in communities? Low-income communities, is it different than maybe a more prosperous community? We found that to be very promising. And we discussed the Every Smile Count program, 3 pilot projects. Virtual dental home, hey, we have an online presence, love it. Community outreach and parent education. We asked specifically, how are the family resource centers going to play a part in this? Where is there going to play an outreach? Is it only going to be family resource centers? Mental dental partnerships, very happy about that. And then we were really excited that the staff's going to come back to the committee in a year's time to discuss the findings. As we know, and as especially working with Commissioner Jones, we realize now, and also Head Start as well, if a child has has dental oral issues, they're not going to learn. So we're very excited about that. So is there any questions?
Any questions for Mr. Silva?
All right, thank you. We'll see you next time.
Okay, next item, please.
Evaluation Committee update.
Commissioner Wirtz.
Yes, thank you. The Evaluation Committee met on July 16th and had a very busy agenda also. One of its action was to approve the outline for the reducing African American child deaths, so that piece is moving forward. But then we had a couple presentations from our evaluators, Applied Survey Research and LPC Consulting, that highlighted some improvements in the Persimmon data collection form. The Help Me Grow is being integrated into that, as well as Birth and Beyond, which is a great new addition, could be cost saving for the Birth and Beyond folks as well as for First 5 here. In addition, then, we reviewed the 2 analyses done by the Applied Survey Research Group, one on the playgroup analyses and the other on the summer camp. And it led to some interesting discussions. First of all, the playgroup analysis showed some significant findings of improvement for those kids who received playgroups who didn't get access to preschool kind of education. So if there was no preschool, it was clear that these playgroups were of some value there. What this led to, we had quite a discussion about how to do the evaluation and so on. And one of the first fundamental notions is that we have pretty much cut the evaluation budget in half. And so we're going to have, I think what became clear to us is we're going to have trade-offs. And that's, us data people always want more data, but we also are stuck with the reality of how to do our work. So one of the things that's happening, for example, is that we're not proposing to do the same kind of annual school readiness analysis that we've been doing, which has been showing such positive results on a year-to-year basis. One reason for not doing that is that we've got the system down, it's in place, it's working, it's having consistently over the last 3 years It's had the same basic results, showing that those kids who receive school readiness services from First Five do better than those who don't receive these preschool services. So that's a trade-off, though. We're no longer going to have an individual assessment around that, and we won't be able to break down some of the priorities that might be possible within that. And that's just the nature of the situation. But it did also lead to some discussion around how evaluation fits into sustainability. And so we've asked Christina to sort of be our liaison to the Sustainability Committee to sort of bring together the two groups to look at how evaluation is going to occur within the sustainability piece and how sustainability can support the evaluation piece. So I think we're pleased with keeping that dialogue going, and we think it's a critical part to the next steps. As I mentioned, Persimmon is continuing to work, but again, there is the question. Ideally, we would like all the systems that First Five funds to have data in Persimmon and have the ability to look at the combination of services. That's still a challenge that we will continue to work on to see what Persimmon functionalities can bring to that. So I think with that, I'll stop and see if Christina or David have any other comments.
I would add, and I think it could make sense in other committees too, if others serve on multiple committees, what it's going to probably look like is there will be a standing agenda item on each of the agendas where I'll report out what the evaluation committee discussed in my sustainability work, and then vice versa. Something, I mean, I haven't fleshed it out with Julie, but I just want to make sure that to serve as the liaison, I want to make sure that that is something that happens at every committee meeting. And I travel a lot for work, so even if I have to call in on the phone and give an unofficial report or something, or provide it in writing beforehand. But that's a really important charge I have. So we'll keep you guys posted on how that goes, but I do think it probably might serve as a good business practice going forward for other committees that might cross over in the future. So that's all I would add.
Thank you.
One other thing I just wanted to mention related to the Maternal Mental Health Collaborative is that in the Cultural Broker program, there is we're adding a maternal depression screener to that service. So it may be that it allows us to identify. One of the dangers of screening for problems is that you better be ready to provide some services to those who you've screened. So anyway, that's moving forward as well. I just wanted to add that, and that's it.
Great, thank you. All right. Financial
Planning Committee update?
I believe that is me, since Kathy was missing. So we met on July 5th, and as Julie reported, we talked about the very sad loss of our senior accountant and the steps that we're going to take to replace that position with just some part-time. The staff presented for review and comment a sustainability goal worksheet and 5-year sustainable budget template, which is the coolest thing ever. It allows, I mean, anyone, but it was designed for some of our contractors to actually enter in some assumptions about what funding they're going to get in the future, and shows them what that gap is, and then walks them through figuring out how they're going to fill that gap. I think any nonprofit could use that, just as far as a, yes, we should patent it and sell it or something. We reviewed the 18-19 proposed budget and the 10-year financial plan, and then we also talked about that $325,000 in additional revenues that the Board of Supervisors has allocated for the first 3 months, and talked a little bit about CalWORKs and the hope that that will backfill some of the lost funding for Birth and Beyond. And we looked at the May 31 financial statements and found no significant concerns. And that concludes my report.
Okay, thank you. Next item, please.
Sustainability Committee update?
Okay, that's me. There's no official report out. We didn't meet in May. And as you know, Julie highlighted a lot of the work in her executive director's report, but I think what that serves as evidence of the sustainability plan that you all approved a while back is in motion. So even if we aren't meeting all of the goals and objectives that were set in that plan are rolling forward. And, you know, I would say, again, Julie's report is evidence of that. So it's really exciting. Our next meeting is scheduled for August 21st, and we'll be providing feedback on the 20th anniversary event. Key messages and reaching out to key audiences will take place, and we'll kind of do some brainstorming on that. And then, you know, again, sustainability touches all of us, and so it's interwoven into what we're doing. So it's really, as a member of that committee, it's really exciting to see how that's played out, and that also speaks to staff. It's obviously a cornerstone of what they do and how they think now. It's a change of lifestyle, right? So they've interwoven that into their daily operations as well. So I think we're just doing a lot of really good work to make sure that, you know, every child is served that we've been serving. So that concludes my report.
Great. Thank you very much. Next item, please.
Approval of retroactive memorandum of understanding with Sacramento County Department of Child, Family, and Adult Services for partial restoration of birth and beyond services and subsequent contract amendments for fiscal year 18-19.
That is a mouthful. So, as mentioned briefly in the Executive Director's report, I'm asking for your approval today to enter into a retroactive MOU with what I call DCFAS. It's just shorter.
DCFAS.
Department of Child, Family, and Adult Services, to receive the $325,000 from the board for Birth and Beyond program, and then your authority to amend the Birth and Beyond contracts to give that money to the Family Resource Centers. This funding provided by the board will keep the Birth and Beyond program whole for the first quarter of the current fiscal year. And the MOU is coming to you as a retroactive item, something I haven't done before, but the board approved the item after our June meeting, and we didn't have a July meeting, so this is the first opportunity to bring it to you. Having the funding for Birth and Beyond pass through First Five instead of just going through DCFAS, it ensures that we can claim MA revenue on it, which is important for sustainability. And it also ensures that there's no disruption of services for all the 0 to 5 families. And then what it does is it keeps all 0 to 5 funding within First Five so that we can monitor all of those contracts and they're all held within one place. And it allows all of the 6+ services to be held in DCFAS, and they monitor all of those contracts. So it just sort of keeps things really clean. So we recommend entering into this retroactive MOU and to amend the expenditure contracts to partially restore Birth and Beyond funding that strengthens families and prevents child abuse and neglect.
Okay, very good.
I will extend thanks to the Board of Supervisors and move the item.
All right. Okay, it's been moved by Commissioner Gordon.
I'll second.
Second by Commissioner Jones. Is there any discussion before we vote? Any member of the public wish to address us on this matter? Seeing none, we have a motion and a second. Let's do a roll call vote, please.
Sorry, who's second?
I did.
Dave Gordon,
Aye.
Beth Hassett,
Aye.
Terrence Jones,
Aye.
Kathy Cossack,
Aye.
Terry Porter,
Aye.
Christina Elliott,
Aye.
Bill Cerner.
Aye.
Motion passed.
Very good, thank you. Next item, please.
Public hearing, approval of final budget and 10-year financial plan for fiscal year 18-19.
Good afternoon, ladies and gentlemen of the Commission. My name is Eric Harold. I am the Chief of Administration for First Five Sacramento Commission. The fiscal year 18-19 recommended budget was approved by the Commission on May 7th, 2018. It is the fiscal year 18-19 proposed adopted budget we are focusing on today. The adopted budget was approved by the Financial Planning Committee on July 5th, 2018. The adopted budget process is meant to make corrections resulting from the Board of Supervisors' June budget hearings and to capture any recent developments in funding and expenditure levels. As a general rule, departments try to keep the changes to a minimum between the recommended and the adopted budget. So with this in mind, I will highlight what has changed since the recommended budget and where it is captured in the proposed adopted budget. There are 3 changes in the adopted budget that I am presenting to you. As was just discussed in item number 8, the Board of Supervisors did allocate $325,000 to the Department of Child, Family, and Adult Services. These funds will be passed through the first 5, through the first 5 contracts, and therefore should be reflected as an additional revenue and corresponding expenditures in the adopted budget. If you go ahead and take a look at attachment 1, the budget detail. On this attachment, you will see 3 blue highlighted boxes. These represent changes to the budget. The box closest to the bottom of the page, this represents the additional revenues we're receiving and is budgeted under miscellaneous intergovernmental revenue account. In the recommended budget, this account had a 0 budget, and for the proposed adopted budget, it has a budget of $325,000. The corresponding expenditure is the next blue box up. It's under Other Professional Services account. This is where our community-based contracts are budgeted. In the recommended budget, this had a budget of $19.2 million and is now $19.5 million for the proposed adopted budget. The next change I would like to discuss is the reallocation of our senior accountant position to an accounting technician. Julie had mentioned this in the ED report. Whenever the commission has a vacant position, it is evaluated to assess if any organizational improvements are practical at that time. In this case, it was concluded that the higher level accounting duties should be provided by the Department of Finance to ensure stability and continuity in our financial reporting. The accounting technician will assume the remaining duties and as well as be our primary claim preparer for the Medi-Cal administrative activity claims. This reallocation will reduce salary and benefits by $46,000. And this saving is then budgeted in the accounting services, which is the top highlighted blue box on attachment 1, and is used to fund the Department of Finance services. Overall, the changes increase our budget to $23.8 million, which is up from $23.5 million, and our revenues to $14 million, which is up from $13.7 million. Okay, if you go ahead and move over to attachment 2, or take a look at attachment 2, the budget highlights. The changes discussed have a minimal effect on the budget highlights. Some of the percentages have changed slightly. The effective parenting line, which is now $10.4 million, was previously $10.1 million. And also under revenues, there's a line added called intergovernmental revenue, which is towards the, I think it's the very bottom left, or a couple revenues up. And that has $325,000 added to it for this particular attachment. Looking at the reserve balance, which is the call-out box at the bottom right on this attachment, our fund balance position has improved by $1.5 million over the recommended budget for the adopted budget. So it's increased by $1.5 million. This makes our beginning fund balance $7.8 million and reduces our reserve release to just over $2 million. So moving on to attachment 3, the 10-year financial plan. On this plan, the green highlighted column is the fiscal year 18-19 proposed adopted budget. The revenue is recorded as miscellaneous, which is under the revenue section of this form. It's the bottom revenue, miscellaneous, and that's, again, for $325,000. The effective parenting under expenses has been increased to $10.4 million from the $10.1. The plan also reflects changes made to the implementation plan at the May 7th commission meeting. Those changes reflected some of our sustainability efforts that resulted in savings and changed the annual expenditures of the implementation plan to $19.8 million, which is down from $20,050,000 annually. The improved fund balance combined with the lower future allocations creates a better down year forecast, reducing our next fiscal cliff in fiscal year 21-22 to a 21% reduction overall. And finally, you're able to see at the bottom of this form the adjustments. Obviously, if our implementation plan is $19.8 million, but our overall budget is $23.9 million, there has to be some one-time adjustments that are made, and this is where that's captured. We had the $1.9 million in the dental capital projects. We have $1.9 million in effective parenting, which includes $1.6 million for MA backcasting, as well as the new $325,000 allocated from the Board of Supervisors in the June budget hearing. We had an evaluation adjustment of $103,000, which was voted on over a year ago by the commission for some extra evaluation efforts required this year. And then $135,000 adjustment to the contracts. Not all the contractors are taking exactly equal amounts each of the implementation plan years, so there's an adjustment that needs to be made. And overall, that comes to $4.1 million in adjustments. And when that's added to the $19.8 million implementation plan amount, it comes to our budget request of $23.9 million. And that concludes my report. Are there any questions?
Questions for staff? This is a public hearing item, so I'll open the public hearing and invite anyone wishing to address the commission on this matter to approach the podium. Seeing none, I'm going to close the public hearing. I do have a question. I'm looking at attachment 1, and I'm looking right at the top where it says total expenses, and you have it listed there for fiscal year 17-18 final budget and 17-18 expenditures. What's the easiest way to explain the 6.3 million roughly delta between the two? If someone were to approach me and said, "Hey, Chair, tell me where that 6.3 million went or where it resides," what would I tell them?
Are you talking about the actuals compared to the recommended budget?
I'm looking at final budget and expenditures for the same fiscal years.
29 versus 23 million.
Yeah.
Okay, so those are, the actuals are the savings, and I do have a form here of what constitutes that difference. And for the recommended budget, or for the final budget of 17-18, the differences are made up for the 6.2 million is a savings in Object 10, which are your salary and benefits of $230,000. Contracts, we had a savings of $1.2 million.
Why is that?
We did not spend the fluoridation capital projects of $2.4 million. We have MA backcasting of $1.6 million. We had a savings in our operational accounts, which is our Object 20 accounts, of $40,000. And then finally, we had Object 90 revenues. We had $790,000 in extra revenues that were not anticipated, which comes to a total of $6.247 million.
So, okay, so the way I look at this is we had a final budget of almost 30 million, 29 change. Then we didn't spend
Right, we didn't spend
$6.2 million of that, which is great news, and it reflects our need to be fiscally conservative here, understanding our declining structured budget. But is the short answer that the savings is going back into programming, going back into reserves? I mean, it's
Yeah, the short answer is it starts out as our fund balance for the next budget, and then, which reduces the amount we need to
so it's part of
release
that
from.
7.7?
Right,
Okay.
correct. And it reduces the need for a larger
Got it.
release from the
So
reserve.
it's kind of a rolling
Savings.
insulation, budget insulation, okay. All right. Other questions for staff? If not, entertain a motion.
Move to approve.
I'll second.
Okay, it's been moved by Commissioner Jones, seconded by Commissioner Cosick. Roll call vote, please.
Dave Gordon,
Aye.
Beth Hassett,
Aye.
Terrence Jones.
Aye.
Kathy Cosick,
Aye.
Terry Porter,
Aye.
Christina Elliott,
Aye.
Phil Cernak.
Aye.
Motion passed.
Very good, thank you. Next item, please.
Sacramento County Child and Family Mental Health Services presentation.
I have just a few comments before Matt joins us up at the podium. So having been in Sacramento now for about 3 years, I've been learning a lot about the various programs that are funded by the Sacramento County Division of Behavioral Health Services, not only through their Mental Health Services Act, but beyond as well. And one thing I can see is a clear connection between the missions of the Department of Behavioral Services and First Five Commission. I've been working to build a closer partnership, especially in the areas of child behavioral health and maternal mental health. And I'd like to see even more joint funding in the future between our two departments. I think we have, like I said, a lot of the same mission, a lot of the same work. And we do currently co-fund one program called the Quality Child Care Collaborative, but I really see a potential partnership in our Help Me Grow program, as well as our new Maternal Mental Health Collaborative. So I just thought it was very timely to ask Matt to come and talk to you all, introduce himself, and tell you a little bit about the Division of Behavioral Health Services. With that, Matt Quinley is a behavioral health program manager, and he's got a couple slides with some highlights for you.
Thank you. As Julie said, I'm Matt Quinley. I'm health program manager. I've been with the Division of Behavioral Health about 22 years. Also wanted to introduce our division manager, Melissa Jacobs. She oversees all of child and family mental health in Sacramento County in the division. And as Michelle had mentioned, we are now part of the Department of Health Services. And am I pointing?
Anywhere, I think you can point. Yep.
So wanted to provide an overview of our services with some emphasis on services to younger children and 0 to 5, and as Julie mentioned, our partnerships with First Five. Sacramento County Mental Health Plan provides a full array of culturally competent and linguistically proficient mental health services to individuals of all ages. So the service array spans from prevention and early intervention to outpatient services to more intensive programs such as wraparound, our flexible integrated treatment, and full service partnerships, which are very intensive, whatever it takes model services, to crisis intervention and stabilization services, and lastly to inpatient psychiatric hospitalization level of services. Most of our children and younger children in our in the mental health plan are served at the outpatient level, and we have community providers throughout the county geographically located providing outpatient level services. And I'll speak more to what that looks like and what an outpatient service entails later, and then also in the prevention and early intervention level of service. Also wanted to mention that as the mental health plan, we're not the sole provider of mental health services to Medi-Cal beneficiaries in Sacramento County. There are 6 geographic managed care plans that would have mental health benefits and provide services to adults and children with mild to moderate impairments. More so on the adult side, many adults can receive services for depression, anxiety, and some mild to moderate impairments at Anthem Blue Cross, HealthNet, Kaiser, Molina, Aetna, and United Healthcare. You may be familiar with our access team, which is really the hub of referrals and where most of our referrals originate. The access team is at the Granite Regional Park complex on Power Inn Road. They operate a call center from 8 to 5, Monday through Friday, 15 licensed clinicians that provide assessments and screenings and refer to providers throughout our mental health system. There are many other entry points to service as well, and I'll touch on some of those as I move through the presentation. But the access team receives about 3,000 calls a month. Sometimes they're receiving various inquiries about other county services, but of those calls, about 1,100 result in service requests, which are actually authorizations to service in our provider network. And specific to the younger 0 to 5 children, in 17-18, we authorized services for 8,689 youth from ages 0 up to 20 or through age 20, and 477 of those were for the 0 to 5 age range. So about 5.5% of those referrals were authorized to 0 to 5 children and families. Some of the providers and services that Access Team might refer a child to: outpatient services. Outpatient services would entail family, individual counseling, therapy services, opportunity for medication evaluation by a psychiatrist, medication monitoring, as well as case management support and plan development. And also important to mention, our family and youth advocates are really integral to our services, and these are folks with lived experience, parents that have experience in juvenile justice, child welfare, mental health, and navigating those systems, and they are very critical in assisting our families, and as well as youth advocates that we have on staff with all our providers to assist with engagement and those that have had lived experience with mental health, receiving mental health services. More intensive services across the spectrum: flexible integrated treatment, allows for more frequent contact, more community work. All of our providers do go out in the community. We know a lot of our families struggle with transportation, so we engage them in the home, in the schools, and the community. Wraparound full service partnerships, I had mentioned, very intensive. Early psychosis intervention program. We have the UCD EDAP program, which does great work and very respected work around onset to psychosis, and for youth that have recognizing that early treatment and intervention has much better outcomes. So the EDAP program serves that population. And then we have some new programs coming out of continuum of care legislation that seek to provide services and keep youth in homes versus congregate care group home environments, that being the short-term residential therapeutic programs and therapeutic foster care. And lastly, some adjunctive services for a youth that might need more specialized assessment. Psychological testing is provided by licensed psychologists for youth that are linked up to a provider but are struggling. There's challenges around diagnostic dilemmas and maybe complex co-occurring developmental disorders. Our psychologists can do a real fine-tuned assessment and testing, and to assist with treatment planning with the providers. And therapeutic behavioral services is also adjunctive, provided with the primary provider to focus on a target behavior or issue, again, for all ages 0 to 21.
A question, Mayor. When you said, go back to that first slide, you talked about the access. Why are you getting those 3,000 calls? Why aren't they, maybe I'm just not understanding, why aren't they not going to one of the 6 medical providers first? Who's calling you, the patient?
It could be caregivers, schools, community members. It could be really anybody. And some folks, our eligibility for children is very broad, so pretty much any youth with a mood disorder, behavioral disruptive behavior, oppositional behavior does qualify within our Sacramento County Mental Health Plan eligibility. With adults, it's a much more tighter eligibility. So with adults, they may be more likely to go to the geographic managed care providers.
I wonder if you're getting calls from 211 or referrals through there as well.
I'm looking at Melissa, who oversees our access team, and yeah, I think we get calls from throughout the community.
So are you verifying that they have coverage and sending them back to the geographic managed
If they
care?
meet our eligibility, we will link them up to services. Speaking to children, yeah, if they meet our eligibility for EPSDT Medi-Cal, and again, if there's a included diagnosis and so very broad eligibility of diagnoses and there's some impairment, then we will link them up to services.
And can you explain once more, what is wraparound? What do you mean by that kind of
wraparound?
Yeah.
So wraparound is a very intensive level service focused on keeping youth in the home environment. So it might include more frequent contact in the community, some flexible funds to assist with whatever utility bills or education or whatever the needs may be, therapy, rehabilitation service. And it's also very similar to our full service partnership, which is MHSA model of service that is, again, whatever it takes, lots of work in the community, frequent contacts, versus the outpatient level, which is probably more of a weekly contact, depending on the needs of the youth.
Thank you.
Yeah. As Julie mentioned, we have collaborations. We're very proud to be a part of the Quality Child Care Collaborative. We've been a part of that for over 10 years, collaboration with Behavioral Health, Child Action, the County Office of Education, the Warm Line, West Ed, Infant Toddler Care, and Child Abuse Prevention Council. We have a assigned mental health clinician who's a specialist who goes out into the child care centers, does consultations, works with teachers to provide strategies and technical assistance, and training. We work with parents as well. So that partnership has been very long-standing. In 2017 and 18, we provided 87 visits. We did have a vacancy in that position. We had a clinician providing that service for many years, and we had a vacancy. So, but we're working on outcomes and working with First Five to fine-tune outcomes. But of the children that we saw in the 17-18 period, 2/3, 67% stayed in that child care, and those were youth that were identified as at risk for expulsion.
Excuse me.
Yeah.
Could I just ask a question on that? Having been involved in that earlier on, one of the issues around the behavioral health consultants was, in the end, that they were not developmental specialists. They were more generic, adult psychologist or whatever. And there was what I recall is the child care centers were saying their staff was as knowledgeable about child development as the consultants. So I'm just wondering whether or not, when you said you have a specialist there, are they trained? Do they have competency in child development and so?
They have back, and we just actually hired somebody new who does come from our child provider system. They are licensed MFTs or social workers. They're not psychologists, but we do. They work closely with the collaborative. So they are a therapist, but
for example, I'm a developmental psychologist, and I only have competencies in certain areas, and an adult therapist is not going to be necessarily the right answer for helping the child care specialist handle that. So that was an issue before in the past, and I just leave it out there that it helps to have that specialty.
Okay, thank you. Also wanted to touch on Help Me Grow, as you're familiar with. We've been excited to be a part of that work group and at the leadership table for, I think, since the beginning, myself and some other managers. Our role, most recently, we had the Warm Line staff and coordinator come out and meet with our access team just to have a discussion so that as referrals are made to the community and as connections are made, that there's clear understanding. And I know that that's just kind of getting up and running. And we know we'll be getting referrals through Help Me Grow and that program with a centralized phone center, referral center, and physician and community outreach and data collection and analysis. And we're very happy to be a part of that. Also, we just, as mentioned, we've just started participating in the Maternal Mental Health Collaborative. We have a program coordinator that is sitting in on that newly formed group. Just to give a little more emphasis on some of our programs that serve 0 to 5 or available to 0 to 5 youth. Community support team I'll speak more about. Mobile crisis support teams, we have 4 partnerships in the community, licensed clinicians riding along with law enforcement, and we're adding 2 more in the process of expanding that. So those, that's been a great partnership. We've engaged a lot of families and provided referrals from those contacts, and there's also a peer component to those that follows up and makes sure that those linkages are occurring. Triage navigators, also professionals located at our ERs and the county jail, and some other sites that assist with referrals and linkage and engagement into our system. The Mental Health Urgent Care Clinic, I have another slide on that. I wanted to mention the Child Protective Services Mental Health Collaborative, newly formed partnership where we have 5 licensed clinicians providing mental health assessment and consultation and participating in the child and family team process with child welfare and CPS. So we'll be part of that planning process, and we're actually in the process of training and onboarding those clinicians right now. And they would serve youth from 0 to 21, the full age range, as those youth come into the child welfare system.
Following up on that, just you mentioned it, child and family approach. Is that the approach for all these interventions? That, say, in preschool or something, you're not just looking at, or are you just looking on the child, or are you thinking about the larger aspects of?
For the child and family team?
I don't know. I'm just trying to get a feel for, say you have a problem in a preschool. Is the intervention based solely on the child? Is it on the child's school? Is it on the, the peers? Is it on the family and the child and the peers? Is it all of those?
Typically all of those, and we do a very, individualized treatment plan, a very thorough assessment, and certainly with younger children, the parents really need to be involved. A lot of the support is with the parents and assessment and coaching with the parents. And I'll speak to a couple evidence-based practices around that a little bit later. But very, very much requires an individualized treatment plan to determine, and a lot of the youth, again, older youth might come in with issues identified in the school, so we'll set treatment goals around those needs. But we would expect our clinicians at all levels to be, working with family. The child and family team process would involve planning with whoever's the child and youth identify as important in their life, as well as other professionals, probation, child welfare. I mentioned the community support team. They are a prevention, early intervention funded program through Mental Health Services Act. A very flexible team that can respond timely. They're not constricted by Medi-Cal billing, so they're really an asset to our system. They will respond to community concerns or any individuals that might be struggling to engage with mental health services. They're licensed clinicians, many of which have experience working with all ages of children, as well as peer support specialists with lived experience that follow up and support those engagements. Mental Health Urgent Care Clinic, as you may have heard, opened in November, an innovation project under Mental Health Services Act. They serve all ages. They voluntary program. They have a medical screening component. They assess for substance abuse. We have psychiatry through UC Davis. And in the 7 or 8 months they've been operating, mostly seen higher numbers of adults, but there's been many cases where families have come in and the team has engaged the entire family and provided support to younger children and got them hooked up with services. And that program is run by Turning Point, and it's on the Mental Health Treatment Center campus where we have a continuum of services now. And they have expanded hours 7 days a week, 10 a.m. to 10 p.m. Monday through Friday, and then weekend and holiday hours as well.
Wow.
I wanted to wrap up with some information on our county clinic, the CAPS Clinic, Child and Adolescent Psychiatric Services. This program is also located near Access Team at Granite Regional Park. We serve the full age range, but we have several professionals and licensed psychologists through UC Davis that have a lot of experience working with younger children, and they often serve to provide consultation to our network providers and our access team. They will do assessments for complex cases that might have co-occurring developmental issues. They provide medication support, trauma-informed therapy, case management services. We have a team, as I said, 4 psychologists that do psychological testing for the whole mental health plan. So they can do that across our MHP. We have an EBP called CPP. It's child-parent psychotherapy that is well-researched, supported by SAMHSA, and really looks at the attachment challenges in youth that have had multiple traumas in their background. So we have a team that's trained psychologists for over 18 months with that practice, and our hope is to be able to train other providers in our system as well. And I mentioned the child and family advocates that we have that play such a critical role. And lastly, another evidence-based practice that has been used for many years is PCIT, Parent-Child Interaction Therapy. We have 6 providers currently equipped with one-way mirrors and audio equipment to provide that treatment to families. It involves coaching parents around communication and parenting. It's a 14 to 20 week intervention, and it's used primarily for our younger children, I believe 0 to 6. Thank you, and I'm happy to answer any questions.
Very thorough, thank you. Any questions for Matt? Commissioner Jones?
Can I just go back to the 0 to 5 population? I'm trying to get an idea of what are some of the interventions that you're looking for. So are we talking about emotional kind of disturbances, ADHD, autism, neurodevelopmental type things?
The autism, again, sometimes we have youth that also receiving services from the developmental, from Alta Regional Services. So we do an assessment to determine, do they have an included diagnosis for our system that we can treat, and can the youth benefit from the service? And so they could have autism, and we would provide the mental health service and partner or coordinate with Alta Regional or other partners. Often a lot of the support is with the parents and education. We'll go into the homes and do assessment. As I said, some of our psychologists will do a very thorough psychological testing process if needed. But they do work with the parents. We do see youth with depression and anxiety at young ages. So again, it really depends on kind of the presentation.
Is one more common? Is emotional problems more common than some of these other diagnoses? And do you have better results with 0 to 5 than you do with?
I don't know that I can say in terms of better results. I mean, I think we do track if youth are meeting treatment goals, and it varies, and often they will address needs, and then they'll come back in later in life or later in adolescence, and they need services, and but certainly addressing the social emotional that comes with depression or anxiety or whatever the presentation may be.
You'd like to think it's early intervention, you get better results.
Absolutely. Yeah.
Commissioner Wirtz?
Thank you. A couple questions. I understand that much of the mental health services are driven by the medical necessity and the diagnosis being in place, and so much of the services that you've talked about fall into that kind of realm. And I guess sort of following up on Dr. Jones's notion about I'm looking for the prevention side of this mental health piece. And having been a mental health professional myself, I know that that's been a hard concept for mental health in terms of both the need for services drives what we do, but also the what's available for prevention services. So First Five has been focusing a lot on the early child adversity and what are called adverse childhood experiences and so on. And the goal of prevention, primary prevention obviously, is to avoid those traumas from happening so that we don't have mental, emotional disturbances and trauma-related consequences. Can you just say if your department is able to provide primary care for prevention of mental health issues? If that's...
primary care for prevention?
Primary prevention. Namely, providing services to families and communities to counteract trauma in the community or avoid trauma in the first situation with children so that we don't have to deal with the early and ongoing trauma that comes from that.
So if they come to our attention, if a referral is made or if somebody reaches out for services, then most definitely we want to provide treatment and engage in services at the youngest age possible, and to provide coping skills and provide support and equip the family to address further challenges down the line. As far as other partnerships or prevention with First Five, I think we're certainly open to exploring that.
Because part of it is the funding kind of mechanism. It's hard to get money to pay for something that you're going to avoid to have happen, So, but I'm just sort of highlighting that mental health prevention, the notion of prevention is not what we would normally think of it as primary prevention, which is stopping something from happening before it happens. Stop violence, before it happens, or that kind of thing. And I think you're stuck as a system with limited capacity to do that given the funding mechanisms. But I'm just wondering if that is, within your vision, within the mission, to look at where those might play. I mean, your notions of the peer support and community efforts really are, potentially engaged in that. If you can fund communities that are working on, changing the environment in which families struggle, then you can be part of a primary prevention. But I'm just trying to get a sense of the degree to which the department sees that as part of their mission.
I think it's very key to the mission. I think one of the nice things with the Medi-Cal funding for children and EPSDT funding is a very broad eligibility. So youth that just have maybe just beginning to struggle or trauma's been identified, we can get them open for services and do some targeted prevention or support. But I don't know if Melissa, if you have more to add.
I would agree.
Okay.
I'd just like to keep it on your agenda because it's being a mental health professional, I know how hard it is to get to the point of saying, let's try to avoid this before it happens, but anyway, thank you.
Absolutely. Do you want to chime in, Julie?
I just want to say just one thing about through the Mental Health Services Act, the agency does have prevention and early intervention dollars, MHSA dollars. One of the partnerships that we have right now is with the Quality Child Care Collaborative, where we are looking to, as soon as a provider would see an issue, we can then call in a consultant to assess the situation and see what kind of prevention can we put in place and what kind of services or supports can we wrap around that family and the provider to keep the child there and not expelled. But this is where I think I was talking about and why I really wanted Matt to come and address the commission is I see so many more partnerships. I see so much more collaboration between our two agencies around the primary prevention and early intervention in the 0 to 5 population. Much of the money is already allocated and goes through a very intensive process for allocating those funds. and just the tiniest little fraction is for 0 to 5. When we, sitting here in this room, know that a bigger chunk for 0 to 5 would prevent so much of those downstream issues. So that's just part of the partnership that we're working on.
Thank you.
You're welcome.
Thank you, Matt. Any other comments, questions? Okay. All right. That was a presentation, so there's no vote. Commission member comments. Any comments from Dr. Wirtz?
Just one announcement that I think goes to the state level. Surprisingly, there was a stakeholder addition to the state budget at the end for a $10 million allocation for All Children Thrive, which is a program that's going to go through community partnerships in Southern California to public health advocates and UCLA. What I'm not sure about, the reason I'm mentioning it is, one, it's a good thing in general, looking at primary prevention for trauma, but they may or may not be selecting counties to be involved in receiving some of the training and support that this program is going to develop around prevention of adverse childhood experiences. I think maybe the contacts is Dr. Flo Coffin, or Coffer,
yes.
excuse me.
Mm-hmm.
So I just thought I'd mention that. Our department is going to be overseeing some part of that, so we're hopefully going to see how that can benefit, children throughout the state. But it's pretty unusual to see a $10 million allocation be added at the last minute, so.
Thank you. I had no idea. Thank you.
Yeah.
Commissioner Jones?
One other thing on the state budget. At the end, there was some agreement between the governor and Big Soda about preventing some revenue. So CDA and California Dental Association, California Medical Association have got together with other partners and are going to put on the 2020 ballot a ballot measure that would, in essence, tax statewide 2 cents per fluid ounce on sugar-sweetened drinks. And, that's going to play out more in the next year and for the 2020 ballot. But they expect that at least something around the neighborhood of 1.7 billion in tax revenue would be available for critical health programs and all kinds of interventions. So they're looking for partners, and I think, I know tobacco has done a wonderful thing in terms of funding all kinds of great programs for a variety of services, and that revenue has also led to decrease in tobacco smoking, and hopefully the same kind of logic will apply with soda, as it's terrible for tooth decay, but also for the obesity and all kinds of different health issues. So I think it points toward something that we all could support.
I've never heard big soda used.
In such an ugly way.
Is there such thing as like big candy or big sugar in your world too?
Yeah, I'm not sure.
Right.
Hey, but I'm open to it.
Okay, before we adjourn, I just want to remind everyone that tomorrow is our annual National Night Out. And this is the one day out of the year where it started with partnership with law enforcement in our local communities, but it's certainly evolved into kind of a bigger production each, first Tuesday in August each year. And a number of neighborhoods across the country, certainly here in Sacramento County, are going to be hosting everything from ice cream socials to lemonade stands and meet and greets with your, local police department personnel. And the case of South Oak Park, part of the district I represent, this will be the fourth year that my office hosts a national night out there, and we have the better part of all of the county departments represented, most of them, and it's residents' opportunity to understand their county government and who does what in county land, and it's always a good time, and we're going to have music and games for the kids, and it's usually a great time. So I certainly invite everyone to come out to Jack Davis Park, and if you can't make it out to Jack Davis Park, certainly look to your local neighborhoods where you live. It's likely that there'll be a National Night Out event for you to enjoy. Yes, Commissioner Kosick.
I did want to announce that SETA will be celebrating our 40-year anniversary on October 10th from 4:30 to 6:30 at our headquarters location, and you will all receive an invitation.
Great.
Oh, great.
Okay. All right, if there's no further business before this commission, we are adjourned.